The IBIS-1 trial is a randomized trial comparing tamoxifen against placebo in women at increased risk of developing breast cancer. What we did was assess menopausal symptoms at 6 months of follow-up and then examined whether there was an association between those menopausal symptoms and adherence at 4.5 years follow-up. And what we showed was that around 2/3 of women are adherent to the full course of therapy, and that there's a significant difference between the tamoxifen and placebo arms, such that around 72% of women in the placebo arms are adherent to therapy, and around 61% of women in the tamoxifen arm are adherent to therapy. We show that there's a faster rate of dropout within the first 12 months of therapy compared with the rest of the time, because thereafter it levels off, and that there's an association between women who report nausea and vomiting with adherence, as well as headaches and adherence. However, there's no association between gynecological symptoms and adherence or hot flashes and adherence. When we stratify those results by the placebo arm and the tamoxifen arm, one of the interesting findings is that there is an association for both the placebo and the tamoxifen arms for women who report nausea and vomiting. For the headaches, that we can only see an association on the placebo arm. For gynecological symptoms, there's an association between those symptoms and adherence, but only in the tamoxifen arm and not the placebo arm. And there's no association at all for the hot flashes. So what this is suggesting to us is that women are experiencing these symptoms, but they may not necessarily be being caused by the medication, and that they're attributing those to the preventive therapy that they're currently taking.